Without any more delay now, let's get started with the second day of Knowledge Factory 2021. Our first session looks at the human cost of fighting disease. What have we learned through our experiences in fighting global pandemics? It's been a raging topic of discussion on many fora, and we have with us someone who is at the helm of helping the world fight this newest pandemic. Dr. Sowmya Swaminathan, WHO's first chief scientist, heads the science division created to strengthen the organization's core scientific work and ensure the quality and consistency of its norms and standards. A pediatrician from India and a globally recognized researcher on tuberculosis and HIV, she brings 30 years of experience in clinical care and research, having worked throughout her illustrative career to translate research into impactful programs. Until most recently, Dr. Swaminathan was Secretary of the Department of Health, Research, and the Director General of the Indian Council for Medical Research. She's received her academic training in India, in the United Kingdom of Great Britain and Northern Ireland, and the United States of America, and has published more than 250 peer-reviewed publications and book chapters. Conversing with her is Dr. Rajat Goyal, Country Director, International AIDS Vaccine Initiative, a non-profit scientific research organization dedicated to addressing urgent, unmet global health challenges, including HIV and tuberculosis. Dr. Goyal has spearheaded the establishment of high-end R&D partnerships and programs with the Government of India, international governments and development agencies, and industry leaders and manufacturers to accelerate integrated discovery and enable equitable access for innovative biomedical products in the low and middle income countries. Dr. Goyal has been working in the fields of cancer, HIV, vaccine research and development, and public health for more than 30 years, and has played a critical role in conceptualizing and setting up multilateral research partnerships, facilitating North-South and South-South scientific cooperation to address diseases of concern in India and across the globe. It's over to you, Dr. Rajat Goyal and Dr. Sowmya Swaminathan.
To say hi to Dr. Sowmya. So it's very clear, as you very rightly said and introduced us and introduced the topic, Reena, that we do understand that, the human race has evolved, science has evolved. We've always been trying to tackle infectious diseases. Survival is in our DNA. But I guess this pandemic, coronavirus, has just kind of introduced us to something really very different. We do realize that there are several forces other than just the agent, which can actually be responsible for influencing human mankind and its survival. So it's not only what causes it, but once it is caused, what it can further lead to. And this is something that I think the human mankind historically hasn't faced. We are continuously challenged. We are learning more and more new things. And I'm so glad that we have Dr. Sowmya, who's just been at the helm of affairs globally, and she understands this so well. And I guess I would like to ask you, Dr. Sowmya, that what do you think, other than just the agent by itself, what forces have been at play which is making this pandemic so miserable? And what do you think has got further introduced, and how it's influencing our society? Just some thoughts from you on that.
Thank you so much, Rajat. And I think, as we reflect over the past year, I can hardly believe that a year has gone by and lives have changed. I think it's the one event, possibly after the Second World War, that has impacted. In fact, it's impacted more people, I think, than were impacted in the Second World War. I don't think anyone in any country has not been impacted in one way or the other. And obviously, we've, at the WHO, been able to see at first hand this impact on people and people's lives and livelihoods. And it's been a very painful and challenging and humbling experience. The fact that this small virus could, in a matter of weeks and months, create this kind of havoc. But then that's what a pandemic is all about. And theoretically, we have known for a long time that it's possible that there's a possibility of a virus, most likely a zoonotic virus, that jumps a species from an animal to a human, given certain circumstances, and particularly if it is a respiratory virus, could actually create a pandemic. And we've had in the past other coronaviruses, the SARS-1 and the MERS coronavirus, but luckily both of them, the viruses have certain properties which enable them to be contained much more easily. And the main difference between this and the previous coronaviruses that have caused outbreaks has been the fact that this virus can spread from person to person, even when the individual is asymptomatic, doesn't know that they have anything wrong with them. They feel perfectly fine. And at the same time, they're excreting the virus when they speak, when they laugh, when they sing, when they cough. And that's how I think the transmission has been very, very challenging to control. Previously, SARS-1, people became infectious a week or 10 days after they started getting symptoms, and they were quite ill by the time they were. So it was really a question of isolating people who were already ill. And that's why the nosocomial spread in hospitals and health centers was much more in that case. Whereas here, people spread in the community without realizing it's not their fault. Didn't know they had symptoms. And as the time passed, we've learned more and more about this virus. And we've also learned what works to control the transmission. Unfortunately, those measures are very disruptive to our day-to-day life. And what I've felt is that some of us, including myself, are very fortunate that we have had the means to be able to survive this new way of life, the new way of living, where we are on online platforms. We still get our work done. And you could argue that it's even more efficient because you're not spending so much time in travel and you're saving resources. That we've got a shelter, we've had places to isolate and quarantine, that we haven't had to really think about, where is the next meal coming from or how to protect the family. But what has really hit hard is the fact that so many families, hundreds of millions of people around the world who were already on the edge and they were just making ends meet and they had dreams for themselves and for their families, those have all been very badly disrupted because the kind of jobs that they do cannot be done online. It involves physical contact, physical work. And many of these people we know have put themselves out there, risking themselves to get those essential things done that we need in our day-to-day lives. And it's, of course, healthcare workers, but it's also all the other essential services that we take for granted. So I think it's just brought back to me the invisible people in society who keep things going and who make life possible for all of us. And we need to think about them. And we need to think about, are they being unfairly treated? And will they come out of this pandemic much worse off than others? So the whole question of equity has come to me front and center. We live in an inequitable world, to be sure. We've always known that. But those contrasts have become so clear. And particularly, I think, in terms of the kinds of work that you can do online versus what you cannot. And, I can give you a lot of data and statistics about the impact on people who are doing different kinds of jobs or have different kind of income levels pre-pandemic. But there's enough proof that the inequities have been widened, and that has implications for peace in the world going forward as well.
Absolutely right. I think very well said, Dr. Sowmya. I mean, I just reflect back, the way the situation is today, whether you're looking at the geopolitical inclusiveness that's happening, the economic insecurity, there's several other factors which have kind of just infiltrated the society and kind of also magnified what you just said about inequity. I mean, I think it's just definitely magnified that. And it just shows that no matter how progressive we feel or how many issues we've tackled, it's yet very much there. It's very much rampant, and it's obviously influencing the way we are tackling this disease, and many more to come. And I guess the human society has a lot to work upon. One of the things that I guess we've all noticed, and I just like to hear your views on it. I mean, all of this has definitely impacted the mental health of a lot of individuals. And I'm just wondering, I mean, when we look at this part of the world, going to psychologists and psychiatrists is not something which is a norm, which is different from the way people in the West deal with it. So I just wonder, with this whole impact coming in and this influence of mental health, what do you think should the society's state of readiness should be to be able to tackle this for the future?
I think that's a really, really important issue that you've touched on, Rajat. And even if we think back to what we have gone through ourselves, each individual, we've gone through so much of anxiety, so much of depression over the last 1 year, sleepless nights, worrying about the future because of just because you don't know, right? It's the uncertainty that's the most worrying factor. Now, of course, there are people being impacted by the disease. So there are those who've either had COVID, and we know that about 10% of people who have COVID could have longer term symptoms, particularly related to neurological symptoms, anxiety, depression, fatigue, etc., which can last for months. So that's direct impact of COVID. Then there's the impact on the families that have lost people or that have had people who've been severely ill in the ICUs, etc., and the tension and anxiety and worry. But then there's also the impact on everyone else because of this physical distancing that has become a norm now. Humans are social animals. We need contact, we need interaction, we need friends, we need our peers, we need our families. And this is particularly for young children. I think the impact on children being out of school for so long and not being able to have that peer interaction is going to have, according to psychologists and neuropsychologists, long-lasting impacts on the cognitive and mental health of children and young people. At least, people of our generation, we've been through life and we've learned to cope with some resilience. Though I don't say that, we are perfect at coping. I think all of us need to reach out and get help. So I think the isolation added to everything else has been a major factor, continues to be today. And we need to think about how are we going to reach out to this. And I've heard people say that the biggest impact of the pandemic could be on the mental health of the entire world. We know about post-traumatic stress disorder for people who've been through acute stress. Imagine the whole world having gone through an acute stress and many people having post-traumatic stress disorder. We'll have to think of ways of supporting each other at the community level. And I think just building up that awareness, reaching out to each other, reaching out to friends and neighbors, giving people a call, where you can have a video call, do that. But otherwise, just a conversation, even on the phone, a hello, remember people who are locked up. And I think of the elderly, and I think of also young children, grandparents not being able to meet their grandchildren. I mean, it's really, when you think about it, a very sad situation. So I think we need to be aware of mental health issues, not blame each other. We need to be kind to each other, show a bit of compassion, even if somebody's behaving in a different way or angry. Reach out if you think that someone needs help or you need help. Please reach out, to your friends or whoever you have confidence in and say, I think I need some help. And I think we need to train more people, Rajat. We don't have enough professionals. And I'm not talking only about psychiatrists, but I'm talking about different levels of health professionals who can provide that support, because I think this is going to be now needed in primary healthcare. Every GP and every doctor and nurse who's delivering primary healthcare will be needed for them to, detect any signs of mental health in their patient issues and raise awareness, but also know what to do, when to refer, when to take it seriously. And I think just starting a conversation around this and the fact that it's not something bad, it's happening to all of us, and we need to help each other, I think, is a beginning.
I mean, you've used some very good words, Dr. Sowmya. I mean, the coping mechanisms, as you said, finding new ways of engagement. I think that's going to be very critical. You mentioned about a few instances, our grandparents sitting at home and we not being able to meet with them. It's so surprising. I mean, we as doctors, I was just, while you were speaking, I was just thinking about it. We as medical practitioners, we've only been told how to touch a patient and heal the patient, how to talk to a patient and engage with the patient and provide better healing. And all those modalities seem to have just gone away. We don't want to interact. We don't want to touch the patient. We want to trust our investigations to be able to manage a patient at the current moment. I guess this moves away from the way we were taught medicine, and we're trying to also learn a new way of dealing with patients. Patients enter a hospital, they're alone. There's nobody there to take care of them, and their relatives, their people from home are just making desperate phone calls and trying to just find out connectivity modalities. How do we get to know what's happening to our patients? So it's just kind of changed the whole milieu, and I just love the way you said that. We need to just accept this. This is going to be the norm for tomorrow. And I think acceptance is the first step to be mentally healthy and try to develop these coping up mechanisms and our engagement mechanism. Another thing that I thought that we could possibly have a little bit of a talk about, Dr. Sowmya, is that, you've been a pioneer in India. And of course, before, as Rini also mentioned before, you took up this position at the WHO. And we always say that what happens in India actually reflects a lot of what happens, at least in the low and middle income countries, if not necessarily in the entire world altogether. But I guess now sitting at the helm of affairs at the World Health Organization, I just wanted to understand that from what do you think is the key role that the WHO is now playing in trying to bring this world together? I mean, obviously when the disease broke out, we read a lot of news. And the key importance that WHO was playing and bringing all the stakeholders together. And now, of course, while that process is going on, then there's the whole issue now about immunization and ensuring that vaccines are available to everyone. So, I mean, how are you balancing it, and how are you trying to ensure that, what are your key priorities there, and how are you going to maintain this equivalent balance across the world?
I think one good thing has happened is that WHO, now everyone knows, I think around the world, what is WHO. I doubt if many young people otherwise would know or care about WHO, but right? So today we're on the news every day. A lot of it has been good press, as some of it has been bad. And I think we have to take the criticism and accept wherever it is, there's a point somewhere we have to find ways of improving. But I think WHO is the only body currently. We have 194 member states, right? So, and each member state has an equal voice when they sit around the table at the World Health Assembly, and they are WHO, they run WHO. We consider ourselves as a secretariat doing what member states want us to do. So it's been an amazing experience actually to see, particularly from my vantage point, which is dealing really with the science, the data, the evidence, and producing the normative work, the guidelines of WHO, how the global community came together, how scientists and experts from all over the world have participated, literally thousands of them. We run webinars all the time. We have expert working groups and advisory committees and guideline development. All of these are made up of people who give their time and their knowledge to WHO because they feel it is worthwhile. And so we've tried also during the year to really improve the way we do our guidelines and disseminate them. We have gone to now a digital format. We update our guidelines on a regular basis. We call it living guidelines. So we've done a lot of innovations there because everyone looks to WHO for the technical guidance. And that's what we need to make sure we're completely evidence-based and data-driven. And that's what we've tried to be throughout this pandemic and before and after. Now, there are things that WHO doesn't have the powers to do. We don't have the powers to go into countries and tell them what to do or what not to do or to find fault. And many people have criticized WHO, saying that, you should have done this, you should have done that, but we can only do it if we get the powers to do that. And I think that's going to be discussed this year. There are many review committees that are looking. There's an independent pandemic preparedness panel and so on that are looking at, can WHO's rules of engagement with countries be changed? What powers do they need? How much more funding and so on? So I think there will be some changes and some reform. But it is the only place currently we have globally where people can come together, set aside their differences in terms of politics, and talk about science and technical. And I think for a pandemic, and in fact for major public health challenges, you take global warming, take climate change, take air pollution, take antimicrobial resistance, and of course, infectious diseases and pandemics, none of them respect national borders. None of them care about your ideology. They will only respond to global coordinated action. So I think that's where we need to rise above our and to some extent it's happened, but I think we need to do more of this. Ideology doesn't play a role here. All of these are problems that we've created. Mankind has created this problem. Man means man and woman. Humankind has created this problem. We have to solve it. And the only way to solve it is to use the ideas which come from around the world. The best ideas might come from the most unlikely places. We have to be open. It will come from the young. I know we have a young audience, so the good ideas are not going to come from people like me. They're going to come from our audience, people in their teens and 20s and 30s. We have to take them seriously. We have to implement. What we can do is to help them to implement their ideas, make the space, a policy space for those good ideas to flourish. Because otherwise we're hurtling towards a common, what shall I say, not a disaster, but yes, ultimately our earth is hurtling towards an irreversible point from where we cannot come back. And the pandemic we will get over, maybe 22, maybe 23, we'll be over it. But climate change and global warming are not going to go away unless we address it. And things like antimicrobial resistance that can also kill millions of people if we don't address. So that's where I think we have to change our thinking a little bit, put aside differences and come together to find solutions.
So I'm glad that you're relating our issues with COVID now going up to global warming and big larger issues we have but on one hand you talked in your beginning, you said about WHO, but I think over a period of time we've also realized why groups like WHO are so critical. And if there was no WHO, imagine what the world would have been like today.
Exactly.
Very, very different. And it goes back to a corollary that we were talking about earlier. From this disease has taught us that how from individuals we need to get back to being together. And definitely, as rather than being individual countries, we need to again come together. I mean, you can't work as inclusiveness. And so it's very clear. I mean, there's several adaptable lessons. I guess one of my questions would be that if you do need these centralized coordinated mechanisms, which can then be adopted and adapted by the world across, no matter which country we are talking about. But there are some other things that, money drives intent many times within individuals, within a society or within a nation. But it's also been very clear, and I would love to hear your views on it, that sustainable resourcing is very, very critical in tackling issues like this across the world. And so how do we address that? I mean, obviously, that's a very key lesson that we've learned. No individual country can do it on its own. And groups like you are very important, like what you represent. So what would be your thoughts on this?
Yes, I think you've hit the nail on the head, Rajat, that for global problems, you need to find global solutions, and you need to find, obviously, any solution is going to need resources, and it's going to need longer term and sustainable resources. Whether now we talk about, building public health infrastructure in countries, and I'm not saying it's only the poor countries. Some of the highest income countries have failed to respond in the way they should have because they have not invested in their public health infrastructure over the years. So whether you start from there or investing in human resources, investing in the kind of data systems that we need, for the future, and whether it's investing in R&D, we've had this incredible phenomenon of having developed, a dozen vaccines in a matter of 12 months, under 12 months. And many of these are now being used widely around the world. And there are another 75 in clinical development and another 200 in preclinical development. This has never happened before. And it speaks to the investments in science and technology that's happened over the past few years. Those investments have paid off now. So we need to keep investing in R&D, in science, but we do need a mechanism like what we've set up now. The COVAX facility for COVID vaccines was set up in April last year to address the issue of access for everyone, equitable access for the whole world. This has never been done before. It was a bold experiment. I believe that it will be a successful experiment, even though right now we are facing supply issues. We're not able to deliver as many vaccines as we would like to. But I think going into May, June, July, we'll be in much better position, just because the supply chains will increase. But the whole concept of having a global mechanism to both invest in R&D for new products, diagnostics, drugs, vaccines, for a threat like this, a biological threat, and having a mechanism which will do pooled procurement and distribution across the world for people everywhere, I think it does need a large amount of resources. It needs global coordination and leadership. And I think when we look back after a year, we could look at the model that's been developed through the ACT Accelerator and the COVAX to see if that's a model that should be kept for the future. But we've also learned lessons on what we can do better in terms of what are the rules of engagement with the private sector. Are there certain things which countries and companies will have to do if a pandemic is declared? We don't have those kind of rules just now. And is there a global regulatory mechanism which will come into play the moment a pandemic is declared? So there could be 4 or 5 actions, a global fund that gets activated as soon as a pandemic is declared. So I think this is the right time to think about those things, learning from what's happened. So a lot of good things, some not so good things have happened. We've learned from that and build a system for the future.
You're absolutely right. I mean, it's commendable how COVAX and ACT Accelerator, I guess we had the Operation Warp Speed being started by the United States government. You have COVID Suraksha, which has been started by the Indian government. I guess these are really great initiatives which actually show investments which can benefit the world and not only the country. So going back to a point that you just made about, how, a centralized fund or a global fund tomorrow for the diseases to come, when you think, you also saw how the groups came together and formed something like CEPI, the work that Gavi does. I guess these are very strong global coordinating bodies, which of course, the WHO being critically involved. So when you look at investments for the future, and I, like you said, there are a lot of youth on watching this show, and I would just say that 2 things which are very critical now to make addressing this particular pandemic more effectively. And one, of course, is the issue of vaccine hesitancy, which I know that there is a rollout happening, and the youths will come into play very quickly now. And I guess that's something that we need to ensure that they take the leadership, they move forward and take the vaccine. Second, of course, is the use of social media. So, and I know that even WHO has been studying this, why are these kind of things happening? What's influencing? Why are countries doing this and not that? So what have your observations been, and what do you think about it?
Yeah, that's been another really interesting phenomenon. And as you know, Rajat, the WHO coined this term called infodemic. And the DG started talking about infodemic right at the last February, actually. So he said there's a pandemic, but there's also an infodemic, which is what it is it's an overabundance of information out there. And we're just bombarded, through all your information channels, social media, news, etc. And you can't differentiate credible information from something which is not true. And a lot of what is out there is not intending to mislead, but we've had this phenomenon of preprints where people who've observed something and who normally write a paper, we are scientists, so we know how it works. You write a paper, it takes months, you submit it to a journal, it's peer reviewed, it takes a few more months, then it's published. By the time it's published, as if it's in a good journal, you can believe it because it's been reviewed by many people. Here, what's happening is everybody's putting out data as they are observing, and which is good because you need to know the latest. But it's many of those papers are very badly done and planned, and those studies cannot be taken at face value. And so that's confused because sometimes journalists pick up those stories and put it on the front pages when normally it would never pass a benchmark of quality. Then there have been people misleading. There are the anti-vax groups, but there are also anti-science groups. I mean, it's very strange that people have conspiracy theories. People are still saying that there's no such thing as this COVID pandemic. It's all made up. I don't understand how there are still people who are saying these things and there are people who are believing them. But the problem with social media is that negative information and rumors always seem to spread faster than truthful information, perhaps because they are much more sensational or whatever. So I think health literacy and scientific literacy of people is very important. And that's something for India and for other countries. We need to focus on the scientific approach that people, it doesn't mean that everybody studies science and becomes a scientist. But I think in our training in schools, we need to inculcate a questioning temperament and also to believe in biological principles and principles of other scientific disciplines. If somebody is saying this is a conspiracy, but then you should be able to gather the facts for yourself and make a judgment on whether it's a conspiracy or not. So I think the lesson for me is that our populations really, and in a way, I think because science has played out on the front pages of newspapers and television channels over the year, I think it's really raised awareness about how science can actually find the solutions and how scientists, are usually working behind the scenes, but now they're in the spotlight. So I think we should take the positives out of this for the future.
You're right. I mean, in fact, there have been, just when you talk about papers, and I was just being reminded of some of the papers we read about the use of social media. And when we all, say that when there's a rampant social media, which is more about bottom-up news, which is just floating around, it kind of influences the society to about 20 to 30%. But if there is a good scientific leader or a scientific mandate, which is with a good amount of awareness, which is then goes top down, it actually ends up influencing the society to 60 to 70%. So it is a huge influence that carries out. I guess one more question that I possibly have is that one of the things that has really influenced vaccine hesitancy, and I think WHO has played a very leading role for vaccines in the past and now and in the future, where everybody around the world said, oh, this is WHO pre-qualified. So the minute the WHO pre-qualification stamp comes in, everybody says, oh, this vaccine is going to work. WHO said it's fine. And everybody uses that terminology. And but in the corona time, how are you doing that? How are you trying to bring in the WHO safety corridor around the products that are being distributed for people to feel encouraged that, fine, there is a global agency which is behind us, and it's not only about this news item that we read, it's certified, it's ready to be taken, the regulators are okay with it. So how are you addressing that? Because the rapidity of development has been very, very different from the way it has been done in the past, as you mentioned earlier. So balancing the two, you want a rapid introduction, but yet need a kind of a certificate which is by a global body like yours. So how does that happen? How does that interplay?
I'm glad you asked that question, Rajat, because it's very much related to the normative role of WHO I was talking about earlier. And so what we did is we actually convened scientists and experts. I talked about our advisory groups in January last year, and going into February, we had this big research and innovation forum, and we laid out what the knowledge gaps were about this. At that time, we knew it was a coronavirus. We didn't know much about its properties. And we also laid out a pathway for the development of vaccines and drugs and diagnostics. And the first things we did was to lay out the criteria, what we call the target product profile. So if somebody is developing a vaccine, what are the benchmarks and what should they be aiming for? Then we work with regulatory authorities around the world to say, let's all agree on the minimum benchmarks for a vaccine. We did that for drugs also, but I'll just give the example of vaccines. And then as these developments were proceeding, we were convening the developers, the private sector and the public sector, to share their data and knowledge. And it's been a very open environment, because what are the kind of endpoints that you decide for your trials? What are the lab assays that you're going to do? All of these need standardization. So our role there, and then finally, once there's a vaccine with some data, it comes to us for the pre-qualification and for the policy guidance. And we have so far, I think we have 4 vaccines that we have provided the SAGE policy guidance for. That is, we've approved of its use, and also we've provided an emergency use listing. In this case, it's not a pre-qualification because it's based on limited data. But the emergency use listing by WHO means that there's a stamp of quality on safety, efficacy, and the quality of manufacturing. And we still have another 5 or 6 vaccines which are in the pipeline now in that process. So certainly, I think that gives countries reassurance, and many regulatory authorities said we will just go with the WHO emergency use listing. We will not need to do our own process, because you don't have the time, the luxury of time here for every country to start going through its own regulatory dossiers, and that would take months and years. So I think it's worked well, and it's really brought out the important role that WHO plays in this space.
Really like to bring in the audience, but before I ask questions, Dr. Sowmya, especially to you, on behalf of our whole team and thousands of young people who are logged into this virtual platform, we just want to say a big thank you to your tireless efforts, for the last year and the year before that. So a big thank you, so much appreciation for it. So if you're okay, maybe take a few questions. We have actually many, but in the interest of time, maybe we can take a couple of them and then you can answer. There are a couple of very interesting questions about the subject that we're discussing, and 1 or 2 questions on the icon that you are. So if it's okay with you, I'll ask a combination of both. So the first one is from Ian Castellino, a BSc student at St. Lucia's College. Genome editing is a major field in biological research today, wherein it's used from increasing productivity, use in crops to human research, etc. Right? So what, in your opinion, will genome editing, will it ever be used on human beings to correct, diseases that we're facing now or in the future? Except for the ethical issues of human experimentation, what are some other problems which you face, and you talk about health and non-health issues on managing the burden of disease that will be faced if human gene editing is legalized and practiced?
That's a great question, because we've seen from the Nobel Prize for Medicine this year went to Jennifer Doudna and Emmanuel Charpentier for the CRISPR-Cas9. And over the last 10 years, I think gene editing, it's clear that the immense potential it has in different fields, as was mentioned, agriculture, veterinary. When it comes to human diseases, we need to think about 2 ways in which gene editing is used. And one is called somatic gene editing, which basically what you're doing is dealing with an individual who has a disease, and you're trying to cure that disease or maybe even prevent it. And it only deals with the cells of the body that will affect you. The other is germline gene editing, where you're actually editing the germline, which means that it can be passed on to the next generation through the reproduction. So that has many more ethical and social and legal implications because you may be passing on a change to future generations that you have no idea what impact it's going to have. And that is why that many groups of scientists last year called for a moratorium on germline gene editing. So the WHO set up a committee to look at the ethical and legal frameworks and governance frameworks for how countries would allow these, because they have a lot of positive benefits. Somatic gene editing for now is being looked at for diseases like sickle cell anemia and thalassemia. And imagine you can actually cure these diseases, potentially some forms of cancer as well. So we should not brush aside that at all. These are the kind of scientific advances we would like to promote. So and they're not, they may have lots of technological challenges, but those I think we can overcome. And eventually I hope that it can become a treatment for people all over the world. That's certainly what WHO would like to see. But on the germline gene editing, I think we will have a recommendation coming out very soon. We have the world's leading bioethicists and scientists discussing this on what could be a potential framework, because we don't want to stop research in that area. It could be that we have indications in the future, but we have to proceed very cautiously, and so we have to work within this framework. And that's something that we will see. The other one, which is similar to this, is the use of artificial intelligence in medicine, both for diagnosis and treatment. And again, we are coming up with this framework that will guide countries on how AI could be used and what could be the pitfalls that we need to be aware of.
In fact, there is a counter question which Chris Alton Pinto has asked on how AI could help in accelerating the publication of peer-reviewed journals. And I would like to add another question by another very young student, Akash Shaji, who says that the biggest catalyst is misinformation, and it sort of leads to all kinds of issues and, undoing of the good work that many other scientists and healthcare workers are doing. So what can we as people, as society do to prevent misinformation, especially on social media?
Well, it's a very good question, but a tough one. Maybe Rajat would also like to come in here. I mentioned the importance of scientific literacy and health literacy. I think, we still have a lot of people in our country who believe in superstitions and in some kind of things which don't have any basis, and all of us have come across that. So I think it's our duty and responsibility to spread rational thinking and thought, and also to inculcate that spirit in our young people, particularly school children. The other thing is we've worked with these social media companies, information companies, including Facebook and Twitter and Instagram and Pinterest and many of these, to be able to flag to them what we think could be really pieces of misinformation or false information or conspiracy theories. And I must say that these companies have become much more aware now, and they do not want to propagate these things. And so they've been working with the WHO. The moment we flag something, they actually review it and then take it down if we identify it as a misinformation. So I think that's the governance of social media that everyone's talking about, which is a tough one. But I think they themselves are realizing they can do much more harm than good if they don't bring controls in. And so how, when, and where those controls can be brought is something for us to debate and discuss. But many countries, as you know, are making rules on IT and how data information is put out. And I think it's a very important debate, but it needs to be a good debate in society. Maybe Rajat wants to add to this.
Just pouring in, but I'm going to now, in the interest of time, restrict it to one, which I'm hoping that you will answer, and maybe Rajat can add a line as well. Anoma Lobo, a BCom student from St. Aloysius College, wants to know about you personally, working in the fields of cancer, HIV, vaccine research and development, and public health now for so many decades, and being an icon to many people like her. What do you think is the biggest challenge you faced along the way?
First, thank you so much for those compliments, which I don't deserve. My work has mainly been in TB and HIV. And I think the learning that I've taken away from my own career is the importance of being inclusive and of listening to people, not just your own peers, because if you're in a scientific environment, you will hear the same thing. And I think and that's true for every community. You move in communities which amplify your own thinking. You never get to hear the other side. And for me, the visits that I've made, to tribal areas, to remote rural areas have been the most humbling and energizing visits, because first of all, you realize there's a whole different world and people who have a completely different worldview and different set of problems. And you need to be able to identify with those if you're going to try and solve those problems for them. You cannot solve it sitting in an ivory tower and then preaching to people what they should do. That it never works. The other lesson for me is in public health that behavioral and social sciences are critical. And as biomedical scientists, we often tend to forget that. And so I think in India also, we need to promote the social sciences as much as we promote, the STEM subjects, because both are needed and necessary. And then the third thing I would say is to always believe in yourself, have an ethical code of conduct and a moral compass, so that you don't do things which, morally you don't feel comfortable doing. And there will be setbacks. I think everyone has setbacks in their career. I had also many setbacks, but I thought that things were not going well and that I could have done much more. But then you have to keep doing it if you believe in the ultimate goal where you're trying to get to. And that is to serve people through public health, through research, through science. And I think eventually you see the benefits of your work. But this is a collaborative process, and science, a few people get big awards and maybe in positions where they're very visible, but behind them and along with them are hundreds and thousands of others, who've done the work. I think it has to be recognized that it's always collective work that results in something which is paradigm changing.
Absolutely right. And Rajat, I know one of the points that Dr. Sowmya made about how important social sciences are to go hand in hand with science in tackling the burden of disease. I know you've talked about it for years now. We're really out of time, but there's so many questions. So my only request to all the people who have joined in on the session is to keep the conversations going. It's for conversations like this that we, brought a platform like Knowledge Factory. And on behalf of all of us, Dr. Sowmya, Dr. Rajat, can't thank you enough. And while we thank you, we also, like Dr. Sowmya said, thank all the millions and zillions of healthcare workers and people who are silently working in the background to help us get over and get us to the other side of the pandemic. A big, big thank you.
Thank you.